Hey everyone, welcome to another edition of EdTalks. Really excited about having Emily Greenwood with us today. Emily, welcome to EdTalks.
Thank you. Thank you. Excited to be here.
So the reason I'm excited to have you is what you're doing at Cincinnati Children's, one of the world's foremost pediatric institutions, is amazing with data. And a lot of times people do great things with data, but it's really retrospective. It's like they look at reports and they can change things from that point forward, but you're doing like real-time stuff. So I want to jump into that. But before we get there, Emily, tell us a little bit about yourself and a little bit about Cincinnati Children's.
Yeah, so I'm the lead business intelligence analyst for the Perinatal Institute at Cincinnati Children's. So we handle all the little tiny babies. We manage the NICU at Children's, and then we provide the physician services at all the regional NICUs in Cincinnati. I've been at Children's Hospital for about 4 years and was a patient at Children's long before I started working there. So just really passionate about our institution and helping improve our patient care.
Yeah, that is so awesome. Give us one or two examples about how you are partnered with the clinicians there and really making this difference. Like, how are they using the data in real time and what the impact is?
Yeah. So we being the Perinatal Institute, started an informatics, we call it a hub, a team of informaticians about 4 years ago with the main goal of bringing data to our clinicians so that they could use it in patient care. So recently we've been working with our lactation consultants in the NICU to try to improve our number of babies receiving breast milk. Breast milk is really important for nutrition for babies. We want them to grow and meet all their developmental milestones. So we work directly with the lactation consultants, and we now have a lactation dashboard where we're monitoring not only if baby gets milk, but if mom has received education or a pump or what her goals are for breastfeeding. And we're allowing that data to be presented in a real-time manner to our staff so that they can actively engage every day with patients and their families in the NICU, especially with mom, and to make sure that she's being as supported as she can be on this kind of journey to help provide breast milk to our babies and to help them grow.
Yeah, that is so awesome. And Emily, I know because I've seen you speak before and we've talked. And what is one of the secrets to having this level of success? Because I know you're really about the people part of all of this.
Yeah, yes. I think that is the big secret, is having your data people really engage and integrate. So I've actually been over to the NICU several times to shadow the lactation consultants and see what their workflow is, how they record data. And we've done a lot of just meeting and consulting with them to see how we can take their note and convert that into some more discrete data fields. So we've been able to make those changes in Epic to help with this real-time reporting. And then just trying to do some of this translation of data language and clinical language so that they understand what we're saying and we can fully understand their requirements. So I think the biggest part of being successful is being able to have your data teams and your clinical teams really integrate and try to understand each other as we work through this process.
Yeah, no, that's awesome. What's one word of advice that you would give other people watching? Because I think we'll have other analytics professionals watching this from other organizations. Like, wow, I want to do what Emily and her team are doing in this real-time analytics. What's one word of advice, or not one word, but a few sentences of advice that you would give someone who aspires to be doing something like what you're doing?
Done at Cincinnati Children's is kind of pursue this federated data model. So like my team, we're fully embedded in the Perinatal Institute. We don't work for Central IS, we work for the Perinatal Institute. But we've developed a lot of really good relationships with Central IS so that we're using the enterprise provided tools, but we have that subject matter expertise of specifically neonatal data. So I think being able to have kind of a embedded team really helps you understand what the clinical goals are. Whereas our Central IS team has kind of a bigger task of supporting multiple divisions, and it's harder to fully understand the ins and outs.
Yeah. No, I love that. That'd be an awesome topic for a future Ed Talks, because you're hitting
Yeah.
that's kind of a sensitive thing. But I agree. I agree with how you all have set it up. Because in the past, there's a sense that IS, we have to own everything, and I can understand it. But there is a way to do a blended model like you all do, and still serves the organization's mission and vision. And at the end of the day, the patient wins and the clinician wins.
Correct. Yes. The patient and the clinician and the data people. We all win because we're all operating in a more smooth and efficient model.
Yeah. Emily, I love that. I I'm so thankful that people, leaders like you out there serving in healthcare and really making a difference in the lives, especially the little babies, like you said, the NICU and the perinatal. So thank you for what you do. And thank you for sharing with us, some of the success that you've had.
Yeah, thanks so much for having me. I really appreciate it.
Okay, that concludes another edition of EdTalks. Thanks for watching.